Hello. All right, I'm going to share my PowerPoint with you. So my name is Brooke, and I'll be going over Chapter 10, pages 107 and 114 through 114, maybe. Okay, so this chapter is called Understanding Medical Tests. A reminder from earlier in Chapter 10 that medical tests generally fall into one of 6 categories: analysis of body fluids and contents, imaging tests, endoscopy, measurement of body functions, biopsy, analysis of genetic material in the cells, and many times these tests are combined into a single procedure. We'll be going over imaging tests. The book breaks it down really easily. You've got the name of the test, other names it's known by, what the test or why the test is done, how the test is done, preparing for the test, what to expect during the test, what to expect after the test, and any potential problems. The tests covered are magnetic resonance imaging, MRI, positron emission tomography, PET scan, nuclear scan, mammography, ultrasound, and coronary angiography, and yes, or heart cath. So for an MRI, why the test is done. This test provides images of the body's interior to detect abnormalities such as tumors that cannot be seen on an X-ray. The test is done by a large magnet producing a magnetic field that causes the body's molecules to briefly change. Radio waves are then passed through the body, and a detailed image is picked up by a computer in slices or cross-sectional views. When you're preparing for this test, you should wear loose-fitting clothing free from metals. What you would expect during this test is to stay as still as possible as you lay down on a table that might put you through a tube. There's also an open MRI, most are a tube. A thumping sound may be heard as images are being produced. This is a 20 to 30 minute test. What you can expect after the test: your usual activities can be resumed immediately. Potential problems: MRI is very safe. However, a contraindication is for people with metal or electronic devices in their body, such as pacemakers, cochlear implants, or clips for blood vessels. Next, we have a PET scan. Why this test is done. It's done either of the whole body to detect cancer, to monitor treatment for cancer, or see how cancer might have spread. It is also used to see how well part of the body, such as the brain, is functioning, or to measure the blood flow. This test can detect damaged or diseased tissue. How the test is done: a substance, such as glucose, with known uptake by certain cells, is attached to a radioactive material and injected into the blood. The radioactive material gives off positrons that are measured, and the abnormal areas are displayed for the study. Preparing for this test, 24 hours before, you should avoid alcohol, caffeine, and any tobacco products or drugs that may alter mental function. For an abdominal scan, they'll have you fast from food and water before as well. What you can expect during this test: an IV line will be inserted with the radioactive material injected. You'll be laying flat, and at times you might be asked to do certain activities depending on the part being studied. So they might give you questions and study your brain function based off of your reaction. This can be a 1 to 2 hour test. What you can expect after the test: usual activities resumed again, and a PET scan is very safe. Nuclear scan. Why this test is done. There are many types of tests, or types of scans, such as thyroid, cardiac, lung, gallbladder, renal, a gallium scan, and bone scan, and these will observe the nature of the organ or region. So this test is done by injecting a small amount of a radioactive material called gallium. It's injected into the blood, and the radioactivity is measured with the scanner to determine where it's accumulating, and it creates images in the body of the accumulation. Preparing for this test, most types of these scans don't require preparation. And what you can expect during the test: the patient will be lying down, the IV line is inserted, you're told to remain as still as possible while the images are being taken. And these images take only 20 to 30 minutes, but if you're monitoring the function or the spread or the accumulation of different things like in a bone scan, the repeated sets can take 2 to 3 days. What you can expect after the test, your usual activities can be resumed immediately, and nuclear scan is safe in almost all people. Mammography. Why this test is done, it's a screening for breast cancer in patients who do not have symptoms of breast cancer. This test is done by simple x-rays taken in 2 views of each breast. In order to prepare for this test, you have no deodorants or powders worn the morning of the test. What you can expect is you'll change into a front opening gown, you'll come up to the x-ray machine, a flat x-ray film cassette will be placed under the breast, and a flat plastic plate will compress the breast on the top so that an image can be taken. There may be some discomfort from the compression. It takes about 30 minutes to take this test. Usual activities can resume immediately after, and mammography is typically safe. Ultrasound. So why this test is done, it can be done for a variety of reasons, including looking for abnormalities like tumors or infections, looking at internal organs, muscles, and blood vessels. This can be done to see organ function, such as an echocardiogram, which looks at how well the heart is pumping blood. This can be used to determine if a mass is solid, liquid, or a combination. And because images are produced continuously, movement can be shown. This test is done using a transducer. This transducer produces high-frequency sound waves that are used to pass through skin and muscle. When the waves strike an internal organ or an abnormal growth, the echoes bounce back and are captured by the transducer, where an image is produced. A gel is applied to the area studied. Sometimes the transducer can be passed inside the body, such as through the anus for prostate images, in the vagina for uterus and ovary image, and into the lower esophagus for images of the heart. There's no preparation for this test. If you're doing something along the abdomen, you might put on a gown. What you can expect is most people find it painless and simple, and you can resume your normal activities afterwards. Ultrasound is considered very safe. Coronary angiography. We can talk about that later, but this test is done to look for blockages in the arteries that supply the heart, the coronary arteries, and to look for damaged heart valves or aneurysms in the heart, specifically. So this test is done by a catheter being inserted into a blood vessel, usually an arm or leg artery, and it's threaded through larger and larger arteries until it reaches the aorta and the heart. Dye can be injected, and sometimes a camera is used or tissue samples can be taken by a tool. To prepare for this test, you would arrange for a ride home, as well as no eating or drinking 12 hours before the procedure. For some people, medication scheduling may need to be adjusted because of fasting. What you can expect during this test. Your patient will lie on a table. You'll be given a sedative to remain still, while an anesthetic is used where the catheter is inserted through a small cut into the vessel. If a dye is injected, the person may experience a warm sensation. This test takes about 1 hour. What you can expect after the test. So this has the longest expectation after. Pressure is applied to the incision site. Often a small sandbag is over a Band-Aid. The person is monitored for several hours, their blood pressure, heart rate, and breathing measured regularly. After 4 hours, the person is allowed to sit, then stand and walk. Usually, they'll return home 6 hours after the procedure and advised to rest the remaining day. So this takes a whole day. Potential problems. Uncommonly, you can have an allergic reaction to the dye. A blood clot may develop where the catheter was inserted or bleeding at the site. The blood vessel may be damaged, and an aneurysm can develop. Rarely, other complications such as heart attack, abnormal heart rhythm, stroke, or death. Thank you for coming to my talk.